if you're someone who's taking finasteride and you're experiencing side effects, I have news for you. They are real, but they're very uncommon. I, in fact, have experienced side effects myself from taking finasteride. Together, we're going to explore how these side effects manifest and present themselves and what you can do to alleviate them. Many of you have a good idea about how finasteride works, but as a refresher, finasteride blocks an enzyme known as 5-alpha reductase, and it decreases a hormone known as DHT, and DHT is a major contributor for hair loss. Look, there is a possibility that you can get side effects from taking finasteride, but the likelihood is really low. 98% of patients have no issues whatsoever taking this medication. With that said, I had a short-term side effect from taking finasteride. I had inner groin pain that forced me to stop the medication because I couldn't tolerate it. Now, I commonly get asked by patients, can you get decreased libido or erectile dysfunction from taking finasteride? And the answer is no. It's possible you're going to get erectile dysfunction because there's a psychological fear that finasteride is causing you to have those issues. But actually, there's no clinical evidence to support that finasteride actually causes ED or decreased libido. In fact, they did a study where they looked at one group that was warned about side effects and one group that was not warned about side effects. And guess what? The group that was warned about the side effects reported a higher rate of having erectile dysfunction. Go figure! So, of course, if you're warned about the possibility of you having erectile dysfunction, you might be fearful. And actually, I was fearful too. Luckily, I had no issues with erectile dysfunction. Now, there's also a possibility, of course, of getting aching of your groin. You can get testicular pain, and you could also get gynecomastia if you're a male, which is enlargement of your breast. There's also the possibility that if you're someone who already has a history of anxiety and depression, that finasteride can make the depression worse. There are 2 times when you cannot take finasteride. If you're female, you're trying to get pregnant, absolutely not. You're not allowed. There's a risk to the fetus. If you're a male and you're trying to conceive with your partner, there's a slight risk of you having decreased semen count. And I don't want you to have any trouble conceiving. So I tell all of my patients, all my male patients, you have to stop taking finasteride before you plan on conceiving. Additionally, when your partner is pregnant as a male, I don't want you on finasteride because there is a possibility that you're going to cause harm to the fetus. So these are the 2 no-nos in terms of when you should absolutely not be using finasteride. If you are experiencing short-term side effects from finasteride, like I did, I was having inner groin pain, I stopped the medication, and then everything resolved. You can stop the medication if that is the case for you, if you have testicular pain, gynecomastia, any depression, anxiety. However, I would say be a little more patient if you're experiencing erectile dysfunction or libido. Give it about a month, see if everything kind of like resumes to its normal state, because normally, as I mentioned, it's usually psychological. And finally, we get to post-finasteride syndrome. But it's even more rare than the short-term side effects that you can get from taking finasteride. Patients who were taking finasteride for many years, who abruptly stopped the medication, reported ongoing issues with erectile dysfunction and libido and mental health issues with depression and fogginess in the brain after stopping the medication. And those issues for some of these patients have not resolved. This is extremely rare in terms of it being reported. And the real belief that we have is that it has nothing to do with the finasteride. There's an underlying medical issue at play, whether that's the erectile dysfunction issue has not been properly diagnosed and treated, or mental health with depression and anxiety is not being treated correctly by a mental health professional, or there's a vitamin deficiency, low vitamin D, low B12. There's nothing in the research to support that finasteride is causing a post-finasteride syndrome. We spent a lot of time talking about potential side effects of finasteride, but I still prescribe finasteride very commonly to my patients because it's an effective medication for hair loss, and the risk profile is extremely low. Yes, you can get aching of your groin, testicular pain, gynecomastia, but it's a safe medication to use. And if you do develop these very rare side effects, you stop the medication. If you have any questions about finasteride that I've not addressed, please leave them in the comments below. Please subscribe to our channel because we're trying to grow our community. And as always, I'm here on your journey to help you address your hair loss.